When men and their families receive cancer diagnosis, it can be scary, overwhelming, and emotional. Often the last thing on their mind is fertility preservation. Many times men and their physicians don't even have a discussion about how treatment can affect their ability to have children. Because cancer treatments are improving every day, many men are beating cancer and living longer. So it's important that men and their families think about preserving their fertility before they start cancer treatments.
I was 23 years old when I was diagnosed with testicular cancer. I was in shock when my doctor told me that I had cancer. When he asked me if I thought about having kids in the future, I didn't know what to say. I was single at the time and I thought about it, but it wasn't something I was thinking about at the moment. I just graduated college. I don't think I would have thought of preserving my fertility before my treatment started if my doc hadn't mentioned it.
When Austin was diagnosed with cancer, he was just 16 years old.
When the doctor tells you your son has cancer, thinking about the future and especially the ability to have children is not the first thing on your mind. As parents, our main concern was making sure that he was cured.
And sure, I wanted grandchildren someday, but Austin was 16. He was just a kid himself. He wasn't thinking about having children. And while it was awkward talking to our teenage son about sperm banking, his father and we wanted him to have that choice for himself. 10, 15, even 20 years from now.
Chemo is used to kill the cancer cells. Sperm and sperm-producing cells are rapidly dividing as well. So chemo targets and kills those cells, leaving men infertile, potentially even after one round of treatment. Sperm banking is the most common method for preserving fertility for men. It can be coordinated quickly, within 24 to 48 hours, and will not affect cancer treatments in most cases.
Austin's doctor explained that it was vital that we bank sperm before his treatment began.
One day we were doing the cancer diagnosis, and the next we were at the sperm bank.
Sure, banking my sperm was a little awkward, but it was an easy process, and I'm glad I did it.
I knew that I wanted to have children one day, so it was very easy for me to decide to bank my sperm. Before I started my cancer treatment, I did just that. It was a quick and easy process. It was very comforting for me to know that even if I couldn't have children the conventional way, that I stored away my sperm just in case.
When you or a loved one has been diagnosed with cancer, there are a lot of emotions to deal with. Thinking about children in the future and sperm banking are probably the last thing on your mind. But it's important to discuss fertility preservation with your doctor and to preserve sperm before any treatment begins in the hopes for your future. For more information on fertility preservation, talk to your doctor or go to urologyhealth.org.